Hi everyone, welcome again to another wellness edition here at Galactic Productions. Speaking to Irene Ogong'o of Patient Support Services Africa and Nurses in Africa. Karibu sana Irene, please say hello to everyone.
Hi everyone. Apparently it's everything in Africa. If it's patient support, it's in Africa. If it's nurses, it's in Africa.
It has to be an African-wide thing.
I am selfish like that. So, how have you been? Perfect.
I ate a lot of cake at the weekend.
Okay, that's too much information.
She did too.
No, I baked a lot of cake.
You didn't eat?
That's different.
You didn't eat?
No, I baked it. I did not eat it. So we are not on the same page.
I was supporting a local business. Anyway, guys, thank you so much for joining us today. Welcome again. And today we're going to be talking about some a bit tearjerky type topics, and especially to the mums amongst us, or those people who've had bereavement with children, and certain stuff like that. So, Irene, I will hand over to you.
Okay. So this week. Well, actually last week, as you go through social media, you'll see a lot of things. The things that stood out for me that have led to this conversation is the kind of experiences that we are getting in different kinds of health facilities. And I thought this would be a good time for us to step back, look at these experiences, and then what do we learn from it?
Yes.
Because that's the only way we empower ourselves.
That's it.
So last week, three things stood out, three different experiences from three very different facilities, but they all added up to the same thing.
Yes.
The lack of knowledge.
Yes.
So the first thing was there was a post about a lady who had gone to see a doctor, and then the doctor wrote an examination, ECG, where they put some notes on you to just check how your heart is.
Yes.
Now this lady said she was shocked when she went into a room. She was followed in there by 5 interns who are all male.
Yes.
And they told her to remove her clothes, then told her to remove her her bra, and she was very afraid because she didn't know what the procedure was about, and that she had to undress in front of the 5 people who were all learning on her.
Yes.
And she was very distressed when she came to social media to complain. Now, for me, every time I see that complaint, I always look at the comments because that helps me to understand how we are thinking.
That's it.
And when I looked at the comments, it
sad.
was really sad because people were saying, is that all?
Yes.
Well, there's no problem. Did they do the ECG? Yes.
Yeah.
Then someone said, when God just utaenda kuzaa.
What?
Wait until the day you deliver. Then you will know that was just a tip of the iceberg.
As if it's supposed to be a normal thing to be mishandled or
to be
not given the information that you need. I mean, the least they should have done was, or could have done, was just let the lady know, listen, it's a teaching hospital, which if you go to a teaching hospital, you kind of expect at some point they will ask you, because consent.
Very key.
Yes, consent is key. So it's like all they have to do is tell you it's a teaching hospital. We have to teach. We are asking you if you feel comfortable with us doing A, B, C, D. This is what the procedure entails. These are the number of people that will be coming in. They will be observing, or they might be helping to put the electrodes, because it's electrocardiogram, isn't it? Put the electrodes on. I know. Anyway, but consent.
Consent is key.
Yeah.
And also for you, the patient, to know that it is okay for you to say, I am not comfortable with having 5 grown men hovering over my chest and practicing beneath my breast.
That's it.
That is not okay. That is not okay. And you need to be able to voice it. Don't just take it in and say, what could I do? I went there. So you went there for the ECG and you left there not feeling happy about the experience.
Yes.
And that made me sad. And for everybody else who was saying, that is okay. It is not okay.
No.
And the reason why that happens is because we don't really know what quality is,
Yes.
what to expect when we go.
Yes.
So anything we are told, okay,
Yes.
no problem.
And we are also socialized, especially in a country like Kenya, kuvumilia.
Kuvumilia nayo.
You know, and then another thing that we've spoken about before is trivializing another person's experiences. Hiyo tu, mimi kwanza usione vile walinifanya, afadhali wewe.
Afadhali wewe.
No, nyinyi nyote hakuna yule yuko afadhali. There's none of you, neither of you is better off.
And that is why patient care is personalized.
Yes.
That is why we don't go as a group and they say ingieni nyinyi wote. No. That is why everybody goes by themselves.
Yes.
Because my culture, my needs, my history, everything is about me.
Yes.
It's different. So my experience should be personalized to me.
Yes.
So the next time we want to comment about other people's experience, it's okay to give your experience.
Yes.
But don't expect the other person to feel the same way you felt.
Yeah, and also don't trivialize their pain.
Yeah,
Or,
because
I think the saddest thing for me, the saddest thing was, especially as women, coming there and telling them, nasi bado ulikubali ukatibiwa. Iyo tu. Some people go through worse. Just because some people go through, ladies especially, ladies, we know how vulnerable we can be.
Yes.
We know this.
Yes.
We know we are more vulnerable because we live in a very patriarchal society. Laws are made mainly by men,
Yes.
for men, and women are generally marginalized and ignored. And our needs generally, even for the women who've made it to the top, don't generally fight for our needs. They're generally. And when I say generally, I don't say mean all of them. So msikuje en masse kuni attack. All I'm saying is, we grow up in a society where it's very patriarchal, where to be a woman up there, sometimes you have to compromise your principles, yeah? Which means you can't fight as hard for your sisters as you would, you know? But if we were kinder to each other, if we stopped telling people, walichapwa tu ngumi, mi kwanza nililala hosi like 2 weeks, you know. It doesn't matter kama mtu mmoja alichapwa kofi, ama mwingine alilala hosi 2 weeks, ama mwingine alikufa. It's all wrong. What is wrong here is the domestic violence.
Yes.
Just like in this case, what is wrong is the lack of patient care, lack of quality.
Yeah.
You know.
That is what is wrong.
And lack of us asking haki yetu.
Yes. And that too. Okay, so the next one, then the next incident that I got out of social media, well, there was this lady who posted about her sister had gone to Kiambu Hospital. I'll mention the name of the hospital because it's been mentioned already.
Yeah.
And when her sister went there, you know, the baby had already passed on in her tummy and she had been admitted, and, you know, they were telling her they're going to conduct a cesarean section later on in the night. And there was a lot of uproar on social media about, you know, that having to be an emergency to be done at that point and everything. So this is okay that everybody was appalled by what was happening. And what made me talk about it is because I went ahead and called the lady, the sister, the one who posted.
Yes.
And the story she gave me about it, I'm like, oh my God, this is sad. Because we fought for just one person apparently. Because the ward where she was, there were 3 other women with also dead babies in their tummies, and one of them had already stayed for 3 days without being attended to.
Yes.
So now, my question being, for those people who don't have a voice,
yes,
for those people who don't have sisters who know I can go to buyer beware and complain,
yes,
what happens? And how do we empower those people? Because it's the lack of knowing that I can voice my issues and that they will be acted upon.
Yes.
What happens to them? You know, because essentially we are still failing as a society.
Yes.
Yeah, because how is it that only the things that people make noise about are the things that will be done? What happens to the things that nobody makes noise about but also need to be done?
Yes.
Yeah, and now in healthcare it's become a norm.
Yes.
Remember, most people who go to the public facilities come from
impoverished
low
areas.
income families and all that. So a smartphone, bundles, and all that, to be able to understand that, you can go to buyer beware and complain, are not on top of their priorities.
On top of, they might not even be aware, because Kiambu is mashinani, which means that most people who are serviced by this facility wako ocha. Some of them maybe ni kabambe moja for their household.
Yes.
Some of us take it for granted because we have multiple phones. One for work, one for this, one for that, na kabambe for till number. So, it's true. But we forget that there was a time, not too long ago, about 20 years ago, ulikuwa unafanya 32 clicks for a smiley. I counted, not get 3310. But there are people who are still in that position.
Yes.
Which means the internet might as well not exist.
Yes.
Yes. I feel like as a society, we need to think about these cases that are highlighted are not isolated.
No, they're not isolated, and that's the word I wanted to use, because we fought for this one person. Yeah, she has gone home. Oh, by the way, she went home. She's fine now.
The other three are still there.
She's not fine. She's going to heal and grieve and all that. But we still have others, Uko. We're not making noise about it. Then what? We wait for the next time somebody else goes to the same Kiambu hospital that everybody talks about.
Yes.
Then they come and make noise on social media.
Yes.
We make noise, then whoever is on social media from Kiambu goes and sorts out that one issue. Then they go quiet again. And we go quiet again.
What can we do ongoing though?
We'll come to it.
Okay.
That's one of the reasons why we're having this talk.
Yes.
So now, the last case study we have was someone complaining about Mpisha Hospital. They went, they paid a consultation fee, they saw the doctor, then the doctor said, you need to do an MRI, go for an MRI and then come back. And this person, when they went to ask for the price of the MRI, they, felt that, the MRI in Mpisha is too expensive. So they want to go and outsource it. So they went and did the MRI wherever and then came back. When they came back, they were told, because they didn't come back the same day, that they have to pay
another consultation
for the doctor to review the MRI. And she felt like that was not the right thing. Yes, she had paid, yes, she was seen, but she felt like she needed to call out the hospital and let them know that she's not comfortable with it. Now, this is an example of somebody who knows their rights. This is an example of someone who knows that they can voice their issues. I could say a thing or two about coming to voice it on social media versus talking to them about it. But she also said she sent an email to them.
They did not
respond. So she decided, okay, I'll take to social media. And you know what happened after she did that? Not only was she called and her money refunded, but the policy was changed and she was made aware of it. So anybody else who goes there and needs to go and get some results and come back will not be charged for consultation.
Okay, however, on the flip side, devil's advocate, was she made aware before that every consultation would cost her X amount?
Yes. So she was made aware about the first one. So when she came back with the results, she did not imagine they will ask her to pay for consultation.
But she's seen the doctor twice.
Yes, but she's seen the doctor twice, but she's coming because the doctor is the one who sent her for the MRI. Basically, when she saw the doctor, they didn't do anything for her.
Okay, she was just sent.
Examined and written for tests.
Okay.
So she was not treated.
But
so
that is part of her treatment.
No, it's not. Because the MRI could have come out negative.
Still, okay. I'm talking from a therapist's point of view.
Yes.
Yes?
Yes.
You come and see me. I spend half an hour with you. That's half an hour of my time that I have to charge you. Yes? I then tell you that you need to go to Dr. So-and-so, ask for an X-ray and an MRI. These are things that I can't personally do. And come back and see me in a couple of days. When you come back and see me in a couple of days, it's another half an hour of my time. All I'm saying is, I will let you know that you have to make an appointment and you will be charged for that next consultation.
I hear what you're saying.
My question is, Was she made aware? Because this is the thing. I don't want people to just go and say, I saw the doctor twice, and pisha walifanya hivi. This is what I don't want.
No, so why I think where she was coming from was the fact that if I had gone and done the MRI in Mpisha, I would have probably come back
seen the doctor.
And seen the doctor.
Yes.
But because I decided to go and outsource it,
pissed them off. Naughty. Yes. No. But what I'm saying is to people, I understand that this case was like that, and I'm glad that they've changed the policy.
Yeah.
However, don't take this as an example
as standard for everyone.
To go take on other institutions.
Yes.
What you need to do is find out, use this as an example to find out exactly what the procedure is before you leave that room. Ask. Now we've got a show on this.
We have
responsibilities.
Yes.
What are your responsibilities?
Yes.
One of your responsibilities is to know exactly how much things are going to cost you, exactly what the procedure is, and that goes with you going in and what? Asking those questions.
Yes.
If you haven't watched that show, please watch. Iko kwa nini? Kutakuwa na YouTube link kwa hii bio. Follow that YouTube link. You can see the other shows. What your rights and responsibilities are.
Yes.
You know.
Yeah. So with these 3 case studies, I want to call them case studies.
Yes.
What I got out of all this is we come from the angle of, and also this Mpisha thing came out with a lot of comments of people, some saying, you should have just paid, it's the doctor's fee, or you should have just, why did you go to outsource the thing? You should have just done it there, or
because
you have insurance, and all those things.
Yeah.
For me, all these case studies, I was looking at the comments, and what stood out for me is that we still don't understand what quality is.
Yes.
And therefore, anything that's presented to us, it is okay. So long as I walk out alive, oh my God, I am grateful. Yeah. Now, what you don't know is, not only is quality something that I'm making noise about, it's now at global level. WHO now already came out with a whole system around delivering quality services for the whole of the world. And out of that, there's a part that says a call to action. The government is being called to action, and there are things they need to do.
Yes.
Healthcare workers have been called to action.
Yes.
There are things they need to do. The hospitals that provide care have been called to action. You, the patient, or potential patient, or client or citizen, or whichever way we want to address ourselves, have been called to action.
Yes.
What I'm saying is, we cannot continue to sit back and hope that they will sort that thing by themselves. Please note that WHO actually defines quality as what the patient experiences it as. So if you go to the hospital and your ECG is done by 10 million men and you feel harassed, that is what quality is.
Yes.
And so that is poor quality. If you go and you have an emergency and a baby dies in your tummy, and they don't take care of you in a timely manner, and you feel harassed about it, that, according to how you've defined it, is what quality is.
Yes.
If you go to Mpisha and they double charge you for whatever and you feel harassed about it, that is what quality is.
Yes.
Now, with that in mind, can we quickly go through how to identify quality where we go? So that next time we're like, okay, I am here. This is definitely poor quality. This is definitely good quality.
Yes.
So that we can stop giving opinions based on just experience.
My feelings. My emotions.
Okay. Now, there are 7 elements to what quality is. Number 1, that quality is effective.
Yes.
Effective means that the care you're given is based on evidence and guidelines. Now, someone asks, how will I know? For guidelines, you will know when your care providers actually explain to you what the issue is. I know some of you have met doctors who will even draw for you and be like, you see this is the problem here, this is what we are going to do, these are your choices. How do we do? Yes. Now that, when you see a facility where they go through the pain of drawing and explaining and everything, know that their care is effective. Evidence-based, we spoke about it.
Yes.
If you go to a facility and nowhere in their walls, on their walls or their website, whatever, they never ever talk about their data, then you know something is not right.
Yes.
They're supposed to be able to tell you, this year, these are the many people who we lost.
Yes.
With us, we lost them, and we are doing ABCD.
Yes.
To ensure we don't lose any more lives.
That's it.
These are the number of readmissions we have had.
Yes.
And we are doing ABCD.
Yes.
So if you don't see any data anywhere in your facility where you go, then you know that quality is still not something they are practicing.
Yes.
It is still not a priority for them. So are we clear? So one, the care is effective.
Yes.
Two, the care is safe.
Yes.
That the facility you go to, they are making an intentional effort to make sure that you don't get any injuries there or a harm, including medical errors.
Yeah.
How will you know this? Some facilities, when you go, when you look around, you'll see a lot of signs. You say, fire exits, those kind of things.
Yes.
Wet floor.
Yeah. Infection control. Yes.
Wash your hands.
Yes.
Sanitize.
Yes. Don't throw things in this bin. Throw things in this bin.
Those are people who are they care for your safety.
Yes.
When you go to a hospital and when you sit with the doctor, they ask you a lot of questions about your history. They're not very quick to send you to the lab. They want to know. What medication do you have? Can I see it? Can you remember? Because at the back of their mind, they're thinking, if I give them any more treatment and they probably have it, that is going to cause harm. So are we together? So next time you go and sit in a consultation room and you don't feel depth, let's not talk about time, because I can sit with you for 1 hour and say nothing. But I can sit with you for 5 minutes and say a lot.
Asking the right questions.
Yes.
Yeah.
So next time you sit with a doctor and they want to get to the root of the problem and they're asking you about your medication and how it's making you feel and all that, and with all these other things we've talked about, then you can say your facility is what? Safe.
Yes.
In some countries, I know we haven't gotten there, but I hope we'll get there. Some countries actually label their facilities. So you will know there's hospitals that have an A in safety.
Yes.
There are those that have B, C, D, and E. Uko kwa E for excellent, wachana nayo. Yes. We have them. So for our country here, we still don't have hospitals that have the transparency.
Yes.
To tell us that in safety we are scoring E for excellence, but we are working towards A.
We have an A for effort.
Yes. So until we get there, you have to use your 2 cents to identify what safety is.
Yeah.
All right. Then number 3, quality means that the care you give, the care you're given is people-centered.
Yes.
You're the center. That's why you go, they ask for your file. They ask for your history.
Yes.
Everything is about you. So your care should be centered on you. So if you go there, how do you know that their care is centered? They will involve you in your care management.
Yes.
They will not just tell you things. They will suggest.
Yes.
So they will say, Irene, it looks like you could be having A, B, C, D. These are the tests we want to do.
Yes.
This one is necessary.
Yes.
This one is not so necessary.
Yes.
This one is, So out of all this, our care plan is suggestion A, B, and C. What do you think?
Yes.
Then you'll say, Daktari, actually, I'm financially constrained. I cannot be able to do this. And the doctor will say, I hear you, my brother. So therefore, because you can't afford this test, let's do A, B, C, D, because they will lead us to. That means that your care is centered on you. Are we together? Yes. So if you go to a facility and nobody ever asks for your opinion of anything, that is not people-centered. AKA the lady who was done for an ECG and nobody wanted to know whether she's comfortable having 5 people be trying things on her. You understand?
Yeah.
So people-centeredness is a quality of the facility you're going to that you want to see.
Yes.
Yes, that they're centered on you or your family member or whoever.
Yes.
The next thing is timeliness. Quality is also timeliness.
Yes.
This one I know people will say, hey, when you go to I don't know which place, you stay the whole day. Yes, timeliness. But how do you define timeliness? Timeliness is not based on the time you arrived there and the time you are seen. Timeliness also involves how communication is done.
Yes.
Because you're not the only one going to that facility.
Yes.
We have a whole lot of people.
Yes.
Someone is bleeding.
Yeah.
Someone is gasping for air.
Yes.
Someone is, you could be stable.
Yes.
Someone is convulsing.
Yes.
All those things define timeliness.
Timeliness.
So the difference is, if I'm going to sit here for more than 30 minutes,
Yes.
is someone coming to communicate with me and say, we are sorry, you are going to wait for a longer period because
We've got, yeah.
then
Yeah.
you sit there comfortably knowing, okay, I am delayed,
Yes.
but because of ABCD, it
Yes.
has been explained.
Exactly.
So I make a choice, and they give you choices of I can wait,
Yes.
or you can reschedule.
Yes.
Some places even have time slots now because they don't want people to be sitting because of COVID. So everybody has their time slot.
Yes.
So if that is the case, then there's an emergency. They always give you the option of, or they should, let me not say always.
Yeah.
They should give you an option of, can we rebook you?
Yeah.
So that you don't have to wait because maybe you have another appointment.
Yes.
So timeliness is a virtue that your healthcare facility should have, but that does not mean that when I arrive like this, I should be seen like this and disappear like this.
Because
No.
we've spoken about this. When you go into a hospital, especially hospitals with emergency departments.
Yes.
Yes. You might be going to see a neurologist. What do they call? Yeah, neurologist, but the expert neurologist in that hospital. Number one, get yourself a GP. We've spoken about this.
Yes.
See your general practitioner who will then refer you if you need. Don't go straight from your bed to the neurologist.
Yeah, because you have already diagnosed yourself.
Exactly.
Yes.
In most cases, it will be a lot cheaper for you anyway, if it's not an emergency, to go to your GP. They will assess you. They can send you for these tests so that when you go to the neurologist, you already have everything.
Yes.
All they have to do is come and like that lady who was sent for the ECG. I don't know if she went through her GP, but all I'm saying is if she had gone to her GP and her GP had deemed it necessary for her to have that ECG, the GP would have sent her for the ECG. She'd have had everything, and then if he needed to refer her, he'd have referred her straight to the cardiologist or whatever.
Yeah.
So then ingestopis maneno ya enda MRI, enda ECG, enda wapi ndio urudi.
Yes.
You know.
Yes.
I think my whole point is when you go into a hospital where they have an emergency department, you will generally wait longer.
Yes.
You're looking at between 2 to 4 hours if you're not an emergency,
Yeah.
unless you have an appointment. And even when you have an appointment, this specialist might be called away.
Yes.
You know.
Yes, because of emergencies.
Exactly. If there's
and they have to go.
that's
into
it. If there's
theater.
an accident,
Yeah.
and your neurologist has to go into theater on a time that wasn't slotted because there's a casualty, they have to go.
Yes.
Now, all these people within these 2 hours, where generally they see people for 10-15 minutes, you can imagine that's at least 8 people.
It is.
At least. So all these 8 people is a backlog now.
Yeah.
You know, and as you're saying, it now falls on the hospital to say, right, he's been called away. We don't know how long he will be. So you have 2 options. We can reschedule, or you can wait.
Yes.
And then
Communication.
Exactly. A
Yeah.
good hospital will generally call the people for that afternoon and say, it's not happening.
Yeah, don't
Yours
come.
is elective. There are emergencies here, and you will not be seen because hata ya list yake ya asubuhi hajaiona.
Yes. And you heard her say, a good hospital should.
Yes.
She didn't say they are doing it. So don't go there and be saying, they said that you... But this is a good time for you to start advocating for these kind of things in the facility you normally go.
Exactly.
Because nobody wants to go and spend a whole day in a hospital. Yes, meanwhile, I'm in pain.
That's it.
Meanwhile, I have other appointments.
Yes.
So please, you need to understand what timeliness means. It doesn't mean your time.
Yes.
It means you'll be put in consideration, but other things also we put in consideration.
Yeah.
So we've talked about timeliness. Number 5, equitable. There's equity. Yes. Mimi najua CEO sasa wacha tu niende pale kwa desk nikasema
all animals are equal but some are more equal than others.
Sir, there is a line. Wacha kwanza nipigie na
do you know who I am?
Kuna vile nimeambiwa kuna line. Oh, come on guys. Really? If you knew you were in a hurry, go there the day before. That's what some cars are written.
Ungeamka mapema.
Na haraka ungeamka jana. That kind of thing. Okay, that's pun intended. But anyway, all I'm saying is yes, it's pun intended because there's a lot of that going on currently. Yeah, we come from that angle of selfishness.
We grew up in an entitled culture.
Syndrome. I call it me syndrome.
Yeah.
So if you want the care you're given to be equitable, if you want to be treated equally with the rest of the people, can you also go there and look at yourself as the rest of the people?
Humble yourself.
You're not here and the other people are here so that you can be going and saying, I know so and so nitakatiwa line.
Yeah.
You know? So that even the hospital you go to are not supposed to allow those kind of things to happen. So that's how you assess quality.
Yes.
If it's the public hospital, I know there it happens a lot.
Yes.
So we need to figure out how we are going to come up with a few systems and processes.
Oh, I know. How about we all just take our place in line?
Oh, okay, that's easy. Yeah.
It's really that simple, guys. It's really, honestly, that simple.
Very.
Most traffic jams in Nairobi, wacha tuketa kwa hospitali, zinafanywa kila mtu apiga laini na kwa roundabout polisi amesimamisha. Unacheki msee ameoverlap hiyo side nyingine. Bado ataenda mahali. Akifika pale kwa roundabout, sasa amefanya makosa. Jua amefanya nini? Ameoverlap. Lakini anajua ataangusha karao ka kitu apite. How about we all just take our place in line? How about next time you go to Huduma Center, we all just take our place in line? How about we all refuse to bribe them? What are they going to do about it?
Nothing. They can't literally.
How about we all of us, kila mtu, we all just do what is right? How about that?
That's easy. That strategy works very well.
I need serikali, I need polisi, I need makasiriko. It only needs one person in your life. One. You. One. The one person in your life that you can control everything about. One.
The one person in your life that you can control everything about.
One.
I like that one. So how about we do that? Take your place in line and be nice. Yes. Number 6.
Yeah.
Integrated. That the care you're given is integrated. That there's coordination.
Yeah.
Biashara yaenda pale, ukifika upige kona ingine, ukifika hapo ulize watchman gate ya number 6B iko wapi? Wachana nayo.
Hiyo kitu umesema tuwezi rudia. Sasa how are we supposed to understand?
No, because it's not coordinated.
That's what I mean. Yeah. Like imagine, you've just said it now.
It's my first time.
It's an imaginary thing.
Yes, and it's the healthcare system. And you have never been there.
Yeah.
And then you're being sent for an x-ray on another floor altogether.
Yes.
And worse yet, when you get there, the person says, umekuja kufanya nini? Okay, shida yako ni gani? They start again to ask for your history. Then they send you to the next place. They ask you again. Oh my God.
Umekuja kufanya nini? Hiyo mashini kuna hapo ndani ni ya nini?
No, they will ask you.
Ndio nasema.
Yes.
Unajua, those are the moments in life. You need someone like, what's his name? This Njugush.
Yeah.
Or Erikomondi. Or
to come and
somebody who will give them an equally ludicrous answer to that.
Yes, because it's crazy.
Yeah.
But you understand what I'm saying.
Definitely.
Our care is so fragmented.
Yes.
So fragmented.
Yeah.
To the point of, you'll go, for example, you'll be on admission, you'll be at the accident and emergency, they'll take all this history from you. The minute you land in the admission bed, they take the same history from you and you're like, niliambia ule sister mwingine, uliniambia? So uliambia ule sister mwingine?
Yeah.
Ebu niambia hata mimi.
Yes.
Unamaliza, daktari anakuja. Ebu niambia tena ulisema aje? Why? Because everybody is documenting wherever they're documenting and it's not all adding up.
Yes.
The reason why integration is important is because the more fragmented it is, the higher you are at risk.
Yes.
For a misdiagnosis.
That's it.
If you have time, read this book. Sharon is going to put the link.
Yeah.
The WHO Delivering Quality Services report. Do you know what is in that report? It said, this part I liked, also didn't like, but it gave us a very good insight of how our care is. It said they took, I think, 10 countries. Then they took 5 patients. 5 cases, sorry, not 5 patients, 5 different cases. Then they told care providers from Kenya, diagnose for us. Care providers from Timbuktu, care providers from 10 different countries. Then they scored us. Do you know what we scored as Kenyan providers?
2.
Do you want to know?
2.
16%.
So hiyo ni kama mbili.
That means that out of 5 cases, we were able to diagnose only 16% correct. Yes. Oh, yes. Thank you.
Yani hata 2 out of 10 hatungepata.
Tulipata 16.
No, not just 16%. 16% inamaanisha we did not get a whole human diagnosis done.
No, we did not.
Because to get that done, we had to do 20%. So I was being even generous for 2 out of 10.
Yes. It literally means the one case we diagnosed the best to our ability. We diagnosed it, we got 42%. So there were 5 cases. You take history, you do lab tests, everything to come up with the diagnosis.
So our whole process.
Case 1, I think tulipata, hiyo kitu nilikuwa naangalia nachoka. Tulipata 0.0%.
So
case 2, case 3, case 5 ndo tulipata 42%.
Where is the problem though? Is it?
The problem is in a lot of things. The problem is capacity.
Yes.
The problem is how our health system has been planned.
Yes.
The problem is how information is coming from the patient. There's a lot of problems. Yes. So that was their way of showing why quality is now what everybody needs across the world.
Yes.
Unfortunately, Kenya was one of the countries that were chosen to go through the study to justify why quality is important.
But that should be fortunate.
It is fortunate.
Because
but it's
now,
also scary to imagine that even with all this drama,
yes,
we still have just 16%.
But at least sasa tunajua pali shida yetu iko.
Sasa
imagine those countries wenye hawajui.
Okay. True.
You know, this is why I always say, yes, things don't happen to us. Things happen for us. Now we know our quality is bad. Now we know our system has failed. Now we know where we're failing. Now we know how to get up.
Yeah. If we look at it as information that we can use.
And
because
again,
knowledge is good.
Yes.
But applied knowledge.
That's it. Is better.
So if we apply it, if we just keep it as knowledge, like we normally put reports one on top of the other, 16%.
Niko na vitabu mingi.
Now, that was integration. So the next time you go to your facility and you're being sent from corner A to B and you feel like you're being asked the same questions over and over, care coordination is not 10. On a scale of 1 to 10, you'll score it 5, 4, 3, based on how many times you're asked the same information.
Can I just say something?
Yes.
Patient Support Services Africa have a record book.
Yes.
I don't know why you don't bring it every time you come here. Yeah?
Yeah.
They have a record book where you can literally have your whole history. Yes? Now, this record book, the first time I saw it, I said it was genius. Now, can you bring it every time you come?
I
is
think
your
I'll just
responsibility.
leave it with you,
Yeah.
so that every time you
Yes,
mention it, you can
exactly.
show it.
So
Because I
this
keep forgetting.
book, this medical record book, is something that you can have your whole history, blood group, every operation that you've ever had, and the thing is, nowadays we live in a digital world where even when you've been for an X-ray, you can take pictures of these things and actually have them digitally.
Yes.
So that you don't always have to walk with the whole big MRI
envelope.
thing like
Yes.
this. You know, it's me envelope is a brown zone.
Yeah. And some facilities actually, they even show you, they even send you videos.
Yeah, but
I
this
saw
is
from-
rare.
from Kitabe.
Wacha tuache kuongea juu ya specialist facilities. Wacha tuongee juu ya hii kawaida. Juu tuko 16%. We are
Yes,
trying to make
16%
people
wapo kawaida.
take responsibility. Tutoke hii 16. Tunusie hata ka 50. You know? Lakini kile musema always, and this is my mantra, personal responsibility. That's why before I said, what if we just one person? Now, what if you got a record book?
Yeah.
And especially for those people with either chronic conditions
Yeah.
or a condition that is going to make you go into hospital for the next few weeks multiple times. Say you've been in an accident, say you've had an operation, say any of that stuff. Get a record book. Get even a file where everything is together that you carry with you every time. Ukipoka karatasi unaingiza. You know what I mean? Because we know the facilities are not doing it. But if enough of us do it, the facility will think,
okay, we need to do this as well. Yeah.
these patients have something.
I mean, and it's hard for every time you go, this person is asking you, that person is asking
Yeah.
you. Keep forgetting. And because our brains don't have that kind of filing system, we'll forget some things
course.
that also make a lot of sense in our history.
Yeah.
That information you forget is what stands between you and a 22,000 MRI.
Yeah.
Because if you give just that one more information,
Yes.
that will add up. So the doctor doesn't send you for investigative. What people don't understand is the more history you give, then the less the investigations will be.
Yes.
But if your history is
Fractured.
and it's fractured, we have to investigate for us to find the answers.
That's
that
it.
means a cost to you.
Yes.
So history is very important.
It's key.
And because you can't keep everything in your head,
Yes.
find a way to document it, to file it.
Exactly.
And we have a solution for you. Yes. Now, the last one, efficiency. That's the facility you choose to go to is efficient. How do you know that they are efficient? You know they are efficient when they don't keep asking you to retake tests that you took last week. And because, that was last week, now this is this week, let's take another test, even if the difference will not be seen. Case in point, hemoglobin. If I check my hemoglobin today, I don't need to check it for another week. But if I come the next week, within 3 days, you're saying, that was the other day, let's do it again. That means that the place you're going is not efficient.
Yes.
They are not, they're wasting
Yes.
resources.
Yes.
Case in point, all these MRIs and whatever. If you go to a place and they say, "Iyo ni ya huko nje, we don't recognize." Because they're wasting your resources.
Yes.
They're not wasting their resources.
Ni ukweli.
It is your resources.
Yes.
And already, healthcare is economically disabling people.
100%.
So every time you go to a facility and you've done your MRIs and all that, and because you're moving from one doctor to the next, this doctor feels like, I need to send you, because if I don't send you, kuna vile sitapata kati yangu. You go and do fresh, the same thing, duplicate. That's not a place you want to be.
No.
I'm sorry.
No.
Because healthcare is not cheap. Even if you have insurance, I'm
Yes.
saying that insurance cannot possibly last you as long as you think it will.
Yeah.
It has a lot of capitations which you haven't read because they're in small print. It has a limit, and
Yes.
you don't know how you will need it na hapo mbele.
Yes.
Most of the covers we have cover our kids and family as well. So if it's 500,000 and you
Yes.
have 5 people in your family, it's really
Uko na
100,000.
100,000 each. Yeah.
Which facility can admit you for 100,000? Tell me. which one, the private ones you want to go to. So every time you look at your cover and say, niko na cover ya 1 million.
Hauna.
Ni ya wewe na watoto wako, na your spouse.
Yes.
And there's capitations.
Yes.
That 1 million does not cover everything you think under the sky.
That's it.
Next, so read the small print.
Again, find out exactly. Cindy, find out exactly. I mean, Irene has a very good point. If you don't understand it, go to the expert. You know, all it takes is you coming and saying, I want to take this cover. Please do it before you take the cover. But it's not too late after you've taken the cover.
Yeah, because
as long as
plan.
Exactly. As long as you understand it, you will not renew the same cover next year.
And it's a good time now. It's December.
Exactly.
Next year it's cover time and all that.
Yeah.
Even if I know some people will be saying, hey, how is that my headache? My employer is the one who pays. Your employer is paying. Your employer does not know your health needs.
Yes.
Your employer knows that it is by law that you should pay insurance.
Now, do you need wamelipia? Do you understand
exactly
what they are covering you?
But if each and every one of you as employees now understands what your needs are, then you'll figure it out and be like, wait, among us, if we are 10, 5 of us are diabetic.
Yes.
And then the cover, you look at it and it's saying, if it's a chronic illness, we can only cover up to this. And you'll be like, no, so this cover is not good for us.
Yes.
Because it means, because if you're diabetic or you have a chronic illness, you have a risk of going to hospital many times.
Yeah.
Yeah, cover yako itaisha. Outpatient ni 50,000. Sayo uko na diabetes. But if the 5 of you come up and say, guess what? We all have this chronic illness. This cover is not good for us because the limit is this much.
Yes.
We want a better package.
Yes.
They will do it.
Yes.
But because none of us does that.
And even better, imagine 5 of you come to Irene and say to Irene, this is the cover our employer has. We want a better cover. Can you give us a better cover? And she consults with you and tells you, this is the best package I found on the market. Now, imagine this. You go to your employer and you present them with a problem and a solution. How much easier is it then?
Even for them, because they're trying to save money. 1, they're trying to save money. 2, they're trying to save time out, absenteeism.
Exactly. So they're still saving money.
Yes, if you're likely to stay home because you're sick longer because of 1, 2, 3, then all these things. Now you have an intentional plan around your healthcare.
That's it.
And it's really sad.
Personal responsibility. Like all this, we have so many resources at our fingertips.
A lot.
The problem is we like to catastrophize. We like to come to people and say, hey, niko na shida. Sijakula. Ujakula si chakula iko kwa fridge. Nilikuwa na watch movies sikupika.
Oh, that was the problem. Okay, I see where you're coming from. Yes. So yes, it's true. Because every day, and you'll see it on social media, every day people are like, I am shopping for insurance cover.
Yeah.
UAP, Jubilee, resolution.
My solution is always Irene Ogong'o, come here.
But even when you go there, it's like, you just talk. When you finish, we are still going to go and pick this one because everybody is picking that one.
Yeah, but the thing
is, none of everyone there knows what the health issues are.
Yes.
Because when's the last time you checked your blood pressure or your blood sugar? Simple. Just for you to say, I am not diabetic or I am not hypertensive. Yes. We don't know. Yeah. So we go and of course the insurance will say, do you have this? No. Do you have that? No. Do you have this? Okay, give the cover. Then within the same year, you go and get diagnosed.
High blood pressure,
diabetes. Then you are admitted. Then the people say, we are not paying. So what do you mean you're not paying?
Yeah.
Yes, because chronic illness that is discovered within the first year of your cover, they don't pay.
So, I mean, this again goes back to the GP. If you had a GP and had a medical exam, simple one, just vital statistics.
Yes.
You know, damu, pressure, nini, hizo, sindio? Aya, you've gone, you've been checked out, heart is okay, kila kitu, high blood, not high blood, blood pressure is okay, sugar is okay, kila kitu. Now, when you go to take this insurance, you can go with the confidence that sina.
Yes. And your history says
hata mkinipata nayo daktari wangu ndo huyu alinicheck on the 2nd of August and I took this cover on the 3rd of August, which means I did not have it when I took the cover, even if I present to you on the 30th of August.
Yeah, because normally people say, see, the insurance people will do their own medical check.
Where?
They do it, but not to the extent that it should.
Alafu unajua conflict of interest kwa insurance. Mimi, as an insurance person, I'm not trying to find what is wrong with you
so that I can insure
exactly.
you better.
Yes.
No way.
I'm trying to cover my bases.
Yes. It's not for you.
Exactly. It's for me. I'm covering my bases. Basically, I'm doing it so that if you have a very bad condition,
I'll be like,
well, you're too risky.
Yes.
But kama ni kitu tu naweza funika macho. Like for example, if your blood pressure is just on the cusp, I will do the test, but I won't tell you to go get treated. I'll just do it. And I'll tell you, kwanza your blood pressure yako haiko poa.
You need to work on it.
Sitakwambia you need to work on it. Haiko poa. Why? Because I know the way you're going, in the next 2, 3 months, 5 months, 6 months, you're coming back.
Yes.
You're going to come and ask us to cover you. Tutakwambia nini? Hapo hatuko. Terms and conditions si ulisoma.
Yes. And next year tena mnakuja mnachukua cover.
Now
I've been hoping to see whether it's on social media or wherever, all these corporate people, corporates, if you're here, managers, yes, if you're watching, please, one of the things you need to be talking about in those your retreats that you're going to plan for a strategy next year is how the healthcare of your employees is affecting your productivity.
Yes,
because it is affecting it. All that absenteeism, sijui nini, all that. Do you really know what kind of employees you have? Yes, it is confidential. You don't need to know.
Yes.
But you're paying for the insurance cover.
Yes.
And every year, insurance
inapanda.
You have to pay again and again. It's not being utilized, but your people are complaining because they are spending money anyway.
Yes.
Part of your retreat, add that one.
Yes.
Let's talk about the health needs
of your
cover is not a cover. That's all I'm going to say. A cover is not a cover. No. Personalize it. Don't corporate it.
Yes.
No.
Yes.
Because we are different.
Yes. And especially let's talk to the people with smaller SMEs.
Because they're likely to tailor make it completely to suit the needs of your people.
We know that the big organizations, some of them are green, some of them are red. We won't mention names because they're not paying us for advertising. But
yes. Don't mention them. Hata kama nimevaa red na white kama
hata mimi nimevaa green lakini ni sawa.
Wewe watu wa red na white. Hata niko na
mimi ni mtu green by the way. Mimi green damu. Sioni kila kitu ni green hata kalamu. I am loyal. Sinanga hata I don't even have another SIM card. I have never even thought about it. I am fully integrated in green.
I'm telling you. But honestly, this would be a good time to see corporates coming out and saying, as part of our Christmas gift, as part of our all those things, that health needs are things that we are putting on the forefront. You cannot possibly have a productive workforce if you don't have any idea about their health needs. That is a lie. Yes, and I'm bold enough to say it. You need to be able to know it. Whether it's not at individual level, but as a manager by now you need to be able to know. Among my employees, 16% have diabetes. That means we are doing ABCD to help them to manage it. 20% have borderline obesity. That means in our corporate activities we are including some Zumba, I don't know, whatever.
Or even disabilities. And disabilities are not always
mental
visible.
health issues,
Exactly.
all these things.
Exactly.
Even if you can't afford an in-house doctor, nurse,
Yes.
whatever,
Yes.
you can definitely afford to have one come periodically.
That's it.
And-
Like we were talking in schools last week.
Yes.
Yeah.
Because those are the issues here. People are spending a lot of time out of work.
Yes.
And one, insurance will not cover it because they didn't know about it.
Yes.
Because they did not disclose.
Yes.
And so they're spending out of pocket money.
Yes.
And then that leads to loans here, loans there, defaulting, joining company image. When you do a root cause, itarudi tu hapo. Hapo.
Kweli.
Yeah. So,
Kweli.
yeah, so we've talked about, the 7 ways that you can identify quality in your facilities. They are effective. They are efficient. Effective means evidence-based and they're using guidelines and they let you know about it.
Yes.
Efficient means they are not wasting resources, whether theirs or yours. All those are resources.
Yes.
And they are not wasting time.
Yes.
Because time means you will be communicated to about delays. There's better planning for appointments.
Yes.
And if it's urgent, they have a way of addressing the urgency without risking people's lives.
Yes.
We've talked about it being integrated so
Yes.
that there's coordination. Isikue all this fragmented care. Everybody is coming to ask you, but nothing is adding up. That it is safe. That when you go there, you're safe. You're not coming. You don't fall in the process. Or nurse A gave patient B the wrong medicine. Why? They don't have systems in place.
Yes.
Or they're bold enough to tell you our safety is E for excellent or A for effort. Equitable. Yes, that's hakuna cha. I know the CEO, therefore I can skip the line.
Yes.
Remember everybody do your part. Everybody stay in line. That's all you need to do. What's the one? Oh, people-centered. That's the last one I had forgotten.
Yes.
If it's not centered on you, then it's not quality. Yes. You matter. You're the boss. The patient is the boss.
Yes.
If each patient walked away from any facility, including the public ones,
Yes.
watafunga. Because wataka hapo wakichunga nani?
Ni kweli.
Yes, I think sometimes the same way healthcare workers one day wake up and say, "Tu must strike." Sisi siku hiyo tunafaa kujichocha.
Mimi si nimesema tukikata kubribe watu watadu. Si wote tu leo tuseme nikienda Huduma Center I will queue. I will wait. I will do.
I'll go early enough with my
book. My
movie.
Kamos.
Na chai.
Kachai kangu.
Hata gideriman albeba
gideri karatasi. Yani nitapanga laini. Kila mtu tu tupange laini. Kila mtu tu we take our turn. If we all did it right. Guess what? Watabaki wakibribia na huko hivyo kule wao wenda kuketi golf.
Yes. And I am calling you to action. Yes, I am calling you to action as a client, as a citizen,
yes,
as a patient or potential patient.
Yes.
We all have a relative who is sickly somewhere.
Yes.
I'm calling you to action.
Yes.
Your action is you need to be able to demand for quality because you now know what quality looks like.
Yes.
You can now identify quality from afar. I have just uko kwa university wanasemanga watu wa graduate wanamwanga I have empowered you. Wanambongo aje?
Sikuenda graduation juu nilikuwa nimezaa.
Tunambongo sijui the power has been something on you I can't remember to go and do ABCD.
Bestowed upon you. It's just because I know English. It's not because I went.
Watu wa English pia wanachokishanga akili. Anyway, yes. I have bestowed the power on you,
yes,
by teaching you what quality looks like.
Yes.
Don't be selfish because even me, I'm not selfish. That's
yes.
why I came to tell you.
Yes.
And you didn't pay me for it. So even you share the knowledge.
100%.
So that every time someone goes to the facility, let them demand for quality.
Really?
Because now you know what quality is.
That's it.
Don't accept things because they are the way they are.
That's it.
You're paying for it. And as Sharon says, even in public hospitals, we are paying for it.
That's it.
Because you pay your taxes.
Pay taxes.
Demand for quality.
That's it.
And in facilities like the one in the districts, Kiambu or any other, how about we start having patient associations?
Yes.
How about that? And go to the facility and say, Sisi kama patient association of Siaya County, tumekuja tunataka kukuwa part of the quality improvement committee here.
We will talk about this one of these days, how to set up these things, because I know we keep talking about personal responsibility.
Yes.
But we need to empower people by showing them how they can actually set these things up, where they can go for advice on how to set them up, how they can create a quorum so that they actually have a voice.
And let us know if you set it up. We'll talk about setting it up. Once it's done, you need that person who can, make the first step.
Tutaleta sauti.
Tutakuja.
Sina to Islands.
I'll go with you. And
without violence.
No. We know how to argue our cases without even shouting. Tunaongea tu pole pole.
We were bestowed upon.
Tunasema points. Yes.
Anyway, guys, thank you so much for joining us today. We're here every Wednesday evening at 6 p.m.
Yes.
We're always talking about a different topic. If you have a topic that you want us to cover, please ongeza hapa kwa comments. Guys, let's not just share this information with each other. Let us share it with the people providing care for us.
Yes.
Because sometimes people have been in the system so long they don't actually realize they're doing something wrong. So the people which should be sharing this with the most, apart from us empowering each other, is the care providers, doctors, nurses, orderlies, all these people who
I'm
work
going to
in
share
a hospital.
it on the nurses platform.
Yes.
Tell them I'm educating people about quality.
Yeah.
So you better educate yourself with this forum so that when they come to ask for it, you know exactly what they're asking.
Exactly.
So that it's not huyu patient ameomoka. Muomoke pamoja.
Na tunaomoka hapa. Because an emancipated people
be wealthy in your
an
brain.
emancipated people.
You know. English,
Guys, thank you so much for joining us. Have a good week. See you again next Wednesday. And don't forget, we have other shows on our Galactic platform. Check out Patient Support Services Africa. Check out Nurses in Africa. Check out that show. Check out Night at TNO. Check me out. We're out.